Lack of enough knowledge on the benefits of harm reduction concept associated with the tobacco industry in Africa has brought about resistance from its people embracing the idea. A Malawian tobacco harm reduction THR advocate, Chimwemwe Ngoma, has since called on the need for scaling up sensitization efforts on the continent so that people are able to embrace this concept for their good. He said this recently at a 2022 hybrid tobacco harm reduction exchange for journalists and harm reduction experts in Kenya. Kondwani Jinere has compiled this report, which is read by Arthur Chokoto.
In his virtual presentation at the 2022 Tobacco Harm Reduction THR Exchange for Reporters Network on Tobacco and Nicotine Industry, Reno Tony, and harm reduction experts, the Malawian THR advocate said Africa should have its own information on tobacco harm reduction. He said there has not been any research on THR in Africa, which is perpetuating the spread of misinformation on the issue. Ngoma said this has resulted in people misunderstanding the THR concept. THR is a public health strategy which aims at lowering health risks to individuals and the wider society at large associated with using tobacco products. He observed that Africa is already using some harm reduction concepts which are working, such as the use of condoms for preventing HIV, circumcision to reduce acquisition of HIV, masks to prevent COVID-19, hand washing to prevent waterborne diseases, and seat belts to minimize injuries during accidents, just to mention a few. For his part, President of the African Medical Association, Dr. Gausi Lechape, said there was need for concerted efforts if THR was to have an impact on the continent.
If you want to reduce harm, you have to get all parties that are involved in harm, the harm producers and those that suffer harm, and governments have to come together so that we can reduce harm, as we do in all other aspects of healthcare, whether it's vaccines, whether it's drugs. When we do talk about drugs, the pharmaceutical company is at the table. If we talk about tobacco harm reduction, those that produce tobacco have.
In his presentation, an oncologist and expert at the Cancer Institute of Senegal, Professor Abdul Kassé, said he believes that the future of tobacco control is there in Africa. But he emphasized that tobacco harm reduction technologies should be taken to all people regardless of social status.
People just don't know about exactly what it is and what it can bring into the tobacco control process. And that's why, to my point of view, these kind of congresses are very important to try and exchange in terms of experiences, what worked in industrialized country and how to bring the technology to low and middle income populations.
A Kenyan public health expert, Dr. Vivian Manyeki, concurred with Professor Kassé on the importance of bringing tobacco harm reduction conversations to people of all manner.
Something is being done about it, but I feel that there's more that should be done about it. Policy-wise, bring in the key people into the conversation, let them know what is this substance abuse, what is this harm reduction, what does it entail, and what will it take, what steps will it take from their side to get us to where we need to be.
The World Health Organization, WHO, says the tobacco-related illnesses are one of the biggest public health threats the world has ever faced, killing more than 8 million people a year, including around 1.2 million deaths from exposure to second-hand smoke. According to WHO, Malawi has close to 1 million active daily tobacco users, and approximately 5,700 people die from tobacco-related infections annually. This year's Harm Reduction Exchange was under the theme, Harm Reduction, Making a Difference in Africa. The main focus of the exchange was on comparative harm reduction strategies that have worked well and their impact on different markets, as well as scientific research findings and the evolving policy development around the globe.